Hello everyone, Dr. Mindy again. So we continue with our lecture series on the pelvic viscera. So this time I'm going to discuss the ovaries. The ovaries are located in the ovarian fossa on the lateral wall of the pelvis minor, and the boundaries of the ovarian fossa include anteriorly the medial umbilical ligaments or the umbilical artery, and posteriorly the ureter and internal iliac artery. The attachments of the ovary we have ovarian fimbria of the fallopian tube that attaches onto the ovary, as well as the broad ligament of the mesovarium and pelvic. Uh, uh, the ovary is also attached onto the pelvic rim by the suspensory ligament of ovary. So there is the fimbria of the fallopian tube, the mesovarium to the broad ligament, and suspensory ligament of ovary to the pelvic rim. Peritoneum again has its relations with the ovary, so the surface of the ovary is not covered by peritoneum, and during ovulation oocytes are expelled into the peritoneal cavity. So this is the location of the ovary here, all right, and that's the infundibulum with the fimbria of the fallopian tube. This is the broad ligament, and in this picture you can appreciate the remnants of the mesonephric ducts. Remember, in embryology, the female reproductive tract develops from paramesonephric ducts, while the male tract develops from mesonephric duct. So if the embryo becomes female, then mesonephric duct degenerates, and you can see the remnants. You have parafuron here, we have the Gartner's duct here, so a porphyron located here. Again, the attachment of the ovary. This is the ovary, this is the mesovarium, okay? This is the mesovarium here, and this is posterior layer of the broad ligament. So we have the mesosalpinx, which is the peritoneal attachment of the uterine tube or the fallopian tube. So the ovaries are supplied by ovarian artery that comes from the abdominal aorta at the level of L2 vertebra, and also uterine artery. And the veins, we have a papilliform plexus of veins that drain into the ovarian vein, and this plexus of vein communicates with the uterine plexus and vaginal plexus, and all these drain into the internal iliac vein. The ovaries drain the lymphatics into the lumbar lymph nodes and are innervated by autonomic nervous system. Sympathetic nerves come from T10, T12 level, while parasympathetic is by vagus, which is cranial nerve number 10. The afferents to the ovaries travel with sympathetic to T10. Then we go to another structure in the pelvis. We'll discuss the urethra, and basically we'll focus more on the male urethra. Now, the male urethra is 15 to 20 centimeters long, compared to the female, which is usually around 4 centimeters long. So the male urethra is 15 to 20 centimeters, so it's longer, and it conveys both urine and semen. The female urethra usually conveys only urine from the bladder, urinary bladder. So the male urethra has parts. So we have the prostatic part that is star-shaped and enclosed within the prostate gland. It's the most dilatable part and has the prostatic ducts and ejaculatory ducts that open into it. Then we have the membranous part that is the shortest and least dilatable. It's a part from external urethral orifice and the narrowest part of the urethra. It descends from the prostate to the bulb of penis and traverses the sphincter urethral muscle and inferior fascia of the urogenital diaphragm. And then we have bulbourethral glands that are found beside the membranous part of the urethra. Lastly, we have the spongy urethra, which is the longest and runs within the whole full length of the corpus spongiosum. It has two dilatations. One, the bulb of the urethra in the bulb of penis, and the other one is the navicular fossa in the glans penis. Two glands open to the penile urethra. We have the bulbourethral glands and the mucus secreting urethral glands. So this is the urinary bladder, this is the prostate. So we start with prostatic urethra here. We say prostate gland and ejaculatory ducts open here. Then we have membranous part here before you get to the spongy or the penile part. So this membranous prostatic is the widest, most dilatable, while membranous is the narrowest, and it's usually enclosed by the external urethral sphincter. It's the narrowest, shortest, and least dilatable, while the prostatic is the most dilatable. So again, you need to remember two dilatations of the spongy urethra, the bulb of the urethra and the navicular fossa, and bulbourethral glands and mucus secreting glands that open into the spongy urethra. So the male urethra is supplied by prostatic arteries from internal pudendal artery, the artery of bulb, and urethral artery, while its lymphatics with the glans penis drains into the deep inguinal nodes, while the upper part drains into internal iliac nodes. The male urethra is innervated by pudendal nerve and autonomic nerve through the inferior hypogastric plexus. Then we discuss the urinary bladder. Urinary bladder in adults lies in the minor pelvis, posterior to the pubis. It's separated from the pubis by retropubic space that contains fat. However, in infants and children, the bladder is in the abdomen. Then it begins to enter the pelvis major at 6 years and reaches the pelvis at puberty. The shape, size, and position and relations of the urinary bladder vary based on the amount of urine in it and also vary with age. So this is the urinary bladder. Okay, in males, that's the position of the prostate gland. So the urinary bladder has an inferolateral surface, superior surface. These are the ureters opening into the urinary bladder. That's the trigone. The trigone, tri means 3. So you have an opening of the ureter on this side, an opening on the other side, and below you have the opening of the urethra. So it forms a triangle. And that's the median umbilical ligament that supports the apex of the urinary bladder. This is the trigone again. Ureter, and a urethra opening here. And inside, the bladder has folds, which we call the rugae. And histologically, it has a mucosa, submucosa, detrusor muscle, which are soft, smooth muscle cells. So urinary bladder has peritoneal relations. On its superior part, it's covered posteriorly, cranially, and anteriorly. And we have what we call the vesical uterine pouch in females and rectovesical pouch in males, which are formed by peritoneum. So anterior to the bladder, we have retropubic part of fat, levator ani muscle, and obturator internus muscle. While posteriorly, in females, we have the uterus and the vagina, while posterior to the bladder in males, we have the vas deferens, seminal vesicle, and the rectum. So these are the sagittal sections. This is male pelvis. You can see the prostate here. This is the urinary bladder. So posterior to the bladder, you have the seminal vesicles, okay, plus the ejaculatory duct. This is the vas deferens, and of course the fascia adenovilia that separates the bladder from the rectum. So seminal vesicles, ejaculatory ducts, vas deferens, and fascia adenovilia together with the rectum. But in females, posterior to the bladder, you can appreciate the vagina and the uterus. Then we have the vesical uterine pouch here, right? Then superior to the bladder in females, you have coils of small intestines and the body of the uterus, while in males, you just have the coils of the small intestine. So superior to the bladder here, intestine separated from the bladder by the peritoneum. Okay, intestine plus superior part of the uterus in the females. Then inferior to the bladder in females, there is the pelvis and the urogenital diaphragm, same as in male, but the males also have a prostate. So surfaces of the bladder, it has a superior surface that faces upwards, inferolateral surfaces that face inferiorly, and posterior surface facing posteriorly and inferiorly. This form the base. Where the base and inferolateral surface converge, that becomes the neck of the bladder. And that's where the lumen of the bladder opens into the urethra and rests onto the prostate gland. So that's the neck of the bladder. So where here, this is the neck of the bladder where you have the urethra and the prostate. So this is superior surface, this is inferior lateral surface. These are the ureters. You can see where they're opening. So support system of the bladder is enveloped by the vesical fascia, which is loose connective tissue that contains vesical venous plexus, and the neck is held by puboprostatic ligament in male and pubovesical ligament in female. The major support is derived from pelvic and urogenital diaphragm. The blood supply of the bladder is by vesical artery. So we have superior vesical artery from umbilical artery and inferior vesical artery directly from internal iliac artery. We also have obturator inferior gluteal arteries, and in females we have uterine and vaginal arteries that also supply the urinary bladder. The bladder lymphatics drain into three different areas: the superior part to external iliac nodes, inferior part drain to internal iliac, while the neck will drain into the sacral and common iliac nodes. The plexus of veins around the bladder will drain into the internal iliac vein, and this vesicle plexus usually envelop the bladder and the prostate in male, as well as the seminal vesicles, the ductus deferens, and the inferior ends of the ureters. They're usually connected to the prostatic venous plexus and also may drain via sacral veins into the vertebral venous plexus. In females, the vesicle plexus envelope part of the urethra and the bladder neck and also receives blood from dorsal vein of the clitoris. This vesicle plexus in female communicates with vaginal plexus. So vesicle plexus in male communicate with prostatic plexus, and in female with vaginal plexus, and in both they can communicate with the vertebral venous plexus. So urinary bladder is innervated by autonomic nervous system. So we have the parasympathetic from pelvic splanchnic nerves, and this offer motor innervation to the detrusor muscle and inhibit the internal sphincter of the bladder. Then sympathetic fibers originate from T11 to L2, and these are usually inhibitory to the bladder and excitatory to the internal sphincter muscle. Remember, during sympathetic innervation, you're inhibiting the bladder and you enhance the function of internal sphincter. But in parasympathetic, you want to encourage filling and also encourage emptying of the bladder. So you inhibit internal sphincter and you give motor to the detrusor muscle. So the external sphincter and other perineal muscles are usually supplied by pudendal nerve. The prostate is the largest accessory gland in the male reproductive system, and it has rich fibromuscular stroma. It's usually located at the bladder neck and usually surrounds the prostatic urethra. There is a sheath that's continuous with the superior fascia of the urogenital diaphragm inferiorly and rectovesical septum posteriorly. It has a base facing upwards, an apex that faces downwards, and also has a posterior, anterior, and inferolateral surfaces. The prostate has two capsules. So a true capsule, which is fibrous and contains the prostatic plexus of veins and nerves, and a false capsule, which is a visceral layer of pelvic fascia that forms fibrous prostatic sheath outside the true capsule. The relations of the prostate: superior to it is the urinary bladder, inferiorly is the urogenital diaphragm, anteriorly is the pubic symphysis and the puboprostatic ligament. Posterior to the prostate are the seminal vesicles, vas deferens, rectum, and the rectoprostatic fascia, which is the fascia denovalia. And through the prostate, we have the prostatic urethra. Lateral to the prostate is the levator ani muscle. So this is the prostate. Superior to it is the bladder. Prostatic urethra passes deep inside it, and then posterior to it you have the seminal vesicle, vas deferens, and the fascia denovalia, which is the rectoprostatic fascia there. Then inferiorly you have the urogenital diaphragm. Laterally, we've said you have the levator ani muscle. So the prostate is the prostatic urethra and ejaculatory ducts that usually divide it into lobes. This is the ejaculatory duct. Okay, we'll divide the prostate into different lobes. So the anterior lobe lies in front of the urethra, and it's usually fibromuscular and has less glandular tissue, while the median or middle lobe lies between the urethra and ejaculatory ducts, and it's glandular. All lobes are glandular except anterior lobe, which is mostly fibromuscular. The posterior lobe is behind the urethra, below the ejaculatory duct, while we have two lateral lobes, the right and the left on each side of the urethra. So anterior lobe is anterior to the urethra. Lateral lobes are lateral to the urethra. The median lobe is between urethra and ejaculatory duct, while the posterior lobe is behind the urethra and below the ejaculatory duct. All lobes are glandular except anterior lobe, which is fibromuscular. So that is the prostate gland with the different lobes. That's the anterior lobe. Okay, that's the ejaculatory duct, prostatic urethra. This is the median lobe and the posterior lobe. Okay, this is the left lobe, anterior lobe. On the other side is the right lobe. This is the ejaculatory